target sessions and invite you to discuss them with the speakers.
Okay, Dr. Swati, yeah, sorry to interrupt. We are live on the social media platforms also. You can take it ahead.
Thank you. Thank you, Satish, and welcoming everyone who is watching live also, along with the Zoom participation, overwhelming participation today we have. Thank you so much for joining in. And let me not waste the time and right away start what is going to happen and going to be discussed in this session. The topic for today is how continuing medical education influences the prescription behavior of doctors. A very interesting topic for all of us to understand, plan, and take out the insights from. Why did we choose this topic and Omni Cures as a collaboration partner for this? Well, you know, Pharma State Academy does CPHE, that is continuing pharmaceutical education. And we are talking about continuing medical education. So as medical CMEs influence the prescription behavior of doctors, we are also we also have this vision that CPHE influences the learning behavior of pharmaceutical professionals, and they keep growing and the industry keeps growing. Well, in this session, how to use CMEs for generating insights. There are a few questions, very important questions, which will be answered. Can the insights collected during CME utilized for enhancement of patient care, paramedicals and all? How perception mapping of CMEs can help in developing effective strategies? And the most important question, how CMEs can globally impact patient care and healthcare outcomes through evidence-based, unbiased, and cutting-edge scientific content. That is the brief introduction of the session. But before we move ahead, I'll briefly introduce the speakers of today. Dr. 𝙍𝙚𝙜𝙚 Bhattacharya, a very beloved speaker at our platform, also a pharma industry veteran with over 40 years of experience in global pharmaceutical MNCs in leadership and managerial roles. He served on Takeda Asia Pacific leadership team and earlier on the executive management team at Merck Serono leadership team. He has launched and built brands in multiple therapeutic segments and managed the overall P&L of the business. Also a member of Leadership Excellence Harvard Business Square, CII National Committee on Pharma, OPPI, and Mumbai Management Association. His exemplary work has been recognized at national and international forums, and I would specially mention his contribution to developing human capital through continuous training and development programs and creating a work environment of trust, fairness, openness, integrity, and corporate governance. Welcome, Ashok sir.
Thank you. Thank you.
The next speaker for today is Mr. 𝙍𝙚𝙜𝙚 Das. He is the founder and CEO of MyRx. It is the prescription company. He has been doing a lot of work in this field and has been creating a wonderful organization all along. Work is in progress also. He has 13 years of experience in the healthcare IT industry, including business analysis and operations management. His business acumen developed through experience in both provider and payer environments with a focus on business development strategies, resulting in improved service levels and cost reduction. He has proven ability to drive results through excellent organizational skills and proven ability in leading teams. He also worked in Tata Consultancy Services and Infosys in various roles and led successful projects. Welcome, 𝙍𝙗𝙜𝙗.
Thank you. Thank you, Dr. Swati.
And our partner and a wonderful speaker for today would be 𝙍𝙚𝙜𝙜𝙗 Srivastava, Marketing Manager at Omni Cures, heading the global marketing at the platform. She has 7+ years of experience in marketing and has worked across different industries amidst product and service companies. A wonderful communicator, as I already told you, you will see yourself with expert domain knowledge. And our partner for today, Omni Cures, let me just in a single line sum it up. It is a one-stop solution for all medical marketeers to drive their digital HCP engagement while activating effective field force communication. It is the only platform authorized to grant CME certificates and credit points in India. Welcome, 𝙍𝙚𝙜𝙜𝙗.
Thank you so much, Dr. Swati, for such a wonderful introduction for all of us. And I have to say that I'm truly filled with gratitude to be sharing the stage today with such recognized and awarded pharma professionals. And before we begin, a biggest thank you to all our dear attendees for sparing time on a busy Sunday to be a part of this discussion today. We will definitely try to, make it worth your while and make sure that you're able to take home some great takeaways for your branding and marketing strategy. So without wasting time, setting the stage for our discussion, I am 𝙍𝙚𝙜𝙤 𝙍𝙚 and I represent Omni Cures today. I'm sure most of you here would know about us, but just to reiterate Dr. Swati's kind words, we are the one-stop solution for all medico marketeers, driving digital HCP whilst activating effective field force communication. So we don't focus our efforts on just digital marketing, but also try to enhance and embrace the entire digital side of pharma marketing. And we are the only partner in India right now which is authorized to grant CME certificates. Omni Cures, in fact, has been actively engaged by the central and various state governments, medical associations, councils, state universities to improve the quality of healthcare through continuous professional development. We're also featured amongst the top 10 global medical education platforms besides Cleveland Clinic and Medscape. Today, we are here to discuss CMEs and most importantly, can CMEs change the prescription behavior of HCPs? Dr. Swati, if you could please pull up our presentation for the day. Sure. Before we begin, I would like to focus the attention of everyone towards one testimonial that we received from a doctor on the topic of CMEs. Thank you so much. I think it's not going in slideshows, is it? Yeah. So digital CMEs have been low stress, a good value for the effort, simple and concise, and takes very little time. Now, this is an excerpt from one of our recent surveys on doctors' preferences to consume educational content amidst increasing patient consultations and, of course, decreasing time spans. So are CMEs something pharma should be focusing on? Is there a big opportunity for pharma to create a positive sentiment in the doctors? And will it provide the good returns that you are expecting? Well, the answer to all of these questions is yes. Doctors definitely feel that CMEs bridge the gap between academic research and their clinical practice. And we firmly believe that the stage is now set today for pharma companies to positively establish themselves as thought leaders through CMEs, taking ahead the offline-online continuum through online accredited CME. With this, let me give away the stage to Dr. Swati, who is kind enough to pull in a couple of questions that we as a company have received by working with pharma over the last decade or so, and also addressing some of the questions that came in from our attendees today.
Wonderful. Thank you, 𝙍𝙚𝙜𝙤, for the wonderful introduction. And now we move over to the discussion. Welcoming again Ashok sir, Saurav and 𝙍𝙚𝙜𝙤. And I'll be putting few questions, sir, which we have rather collated from surveys with the help of Omni Cures. And let us try to answer those questions in whatever way possible with our insights over the same. So the first question to Ashok Bhattacharya sir, even all the panel speakers are invited to speak, but Ashok sir, to you, I'll ask this. How is conducting the CME, scientific event, linked to change in prescription writing behavior? And, as change in prescription writing behavior requires a persistent and consistent effort, and it needs a lot of scientific evidence. So how this is linked and how it works, I suppose even 𝙍𝙚𝙜𝙤 can elaborate over that.
Thanks, Swati. First of all, it's a privilege to be there with you today and discuss on a topic which is very close to my heart, and have been practicing it for long years as such. Now, as you rightly put it, CME is just a continuing medical education. And we all know that medical science is absolutely dynamic. Every day, every moment, new data are coming, new clinical informations are coming in, and the role through this CME is to disseminate this knowledge. Doctors are awfully busy. Let's make the doctors come to a platform, listen to it about the latest advances in the field of medical science, whether it is the diagnostic procedures, whether it is new diseases, whether it is new therapeutic approaches. So what happens really in a CME program? The CME program really disseminates the knowledge on all these three platforms and also presents new clinical data and new therapeutic approaches for better healthcare outcomes and better patient outcomes. So how it happens? Now today, for example, a doctor in a particular disease area, for example, hypertension, and doctors are prescribing a certain group of molecules or drugs which are there. Now, there becomes, through research and development, new molecules come to address the unmet need of the current molecules. How do you spread this knowledge? How do you ensure that the patients get benefit of the new innovative medication for a better health outcome? So it is through the CME, and we have seen that when you present the scientific data in a CME program, the doctors think about it, reflect upon that, mentally, they map a patient picture, a patient profile, and when such a patient comes to them, when they diagnose about the certain types of hypertension, they say, oh, this is a new molecule. Then this meets some of the unmet needs of the existing molecules, and they shift over to that particular. Now, let me at the same breath tell you that every molecule has got a place in the treatment of hypertension. It depends on what type of hypertension it is, and that accordingly, the doctors shift. Clear examples have been in the area of diabetes, which is there. I mean, in the early days, if you have seen, it was sulfonylurea and metformin, which was only there. Then came the DPP-4, and then came the SGLT2. Look at the shift of prescription behavior of doctors from just metformin to sulfonylureas to the DPP-4s and the SGLT2 and the GLP analogs wherever it is there. Now, you look at the prescription shift which has happened even for SGLT2. Products like empagliflozin or, I mean, any of these glyphosines, it has been seen that the patient gets benefited for heart failure, not only with comorbid condition like diabetes, but also a standalone heart failure. So the doctors have started embracing the SGLT2 for such. So the CMEs, the prescription behavior reflection of the shift has taken place in terms of using the drug in different conditions. So that's clearly evident, and this has happened through continuous medical education, through scientific deliberations, presenting new clinical data. So, I mean, Saurav is there. He will be able to further elaborate that the impact of a physical reflection of a doctor in terms of prescription is vividly seen in the analysis and Saurav's digital prescription analysis.
Yeah, thank you, Ashok sir. And very nicely explained. I agree with you where these CMEs, if held in a planned manner, is going to help the doctor in a big way. Doctors are busy and they are very focused on patient treatments. And these interventions, when they come in at the right time in a planned way, they help the doctors in all along. Saurav, would you like to add something to what Ashok sir said?
Yeah. So Ashok sir has already mentioned about how it has been like pivotal in shifting the prescribing habits of the doctors. Let me not touch on that aspect because Ashok sir has beautifully explained it. What I would like to make you understand, like today, it is a digital generation. So in fact, the doctors are practicing digitally, and along with that, the CMEs need a digital shift, in fact. So company like Omni Cures, they are already doing great jobs in front of CMEs. So there is no doubt that CME has been very pivotal since ages, in fact. So when I was a small child, in fact, my father was into pharma profession. Not many of these people will be knowing it. But since my childhood, like when I was in class 7th and 8th, I was actually visiting CMEs with my like fathers. So the thing is, like, I have seen the medical educations, and along with that, it has been a platform to share the scientific knowledge. But at this point of time, what I am seeing in the current MyRx platform, like specifically for the prescription writing, so there is a lot of interventions, and this has to be on a repetitive basis, not a single event, and we cannot say that, okay, the doctor's prescribing habit is changing. So interventions are required. And along with that, when the digital is coming and the contents are on demand, like, we can get it from anywhere, and we can, the patient's level of the doctor, and we all have shifted actually. So earlier we were addicted to see videos in YouTube, the long videos and everything, but now the shorts has replaced it. So the practical thing is, like, CME is definitely going to change the behavior, and it has been doing it since ages. This is going to continue in future also. And as a prescription company, I am definitely seeing that whenever there is a CME getting conducted, after that, doctors communicating with each other, and along with that, they are prescribing the new formulations to the patients on a trial basis. Just to take an example of a PMS study, like in fact, a post-marketing surveillance, which we have conducted in past. So it was something like a lot of CMEs were already, planned by the pharma companies. So it was on a zonal level, it was on a state level, and along with that, the national level. So a lot of speakers came in. And once the CME was done, there was a continuous effort by the field staff to go and share the case studies, to create a forum between the doctors, so that at least doctors are getting, opportunity to communicate between themselves. And this is the collaborative effort of the pharma companies as well as the doctors in deciding on the case studies and deciding the, in intervention of your patient health outcomes. And yeah, the brand has been established now. It has been 2 to 3 years back when the new molecule was launched and the new delivery system was launched for the drugs. It was into actually sleep melatonin spray, in fact. So we have seen this type of shifting, in fact. So CMEs are very vital in changing the behavior of the doctors, but the only thing is, like, the delivery need to be rethink. So the traditional CMEs and the digital age CMEs, it required a lot of fitment issues, and there are a lot of gaps, which I believe that Shivangi will also be, like companies like Omni Cures and Shivangi, they will be saying about it. So that's it. CMEs are very, very vital, in fact. But the way of delivery has to change.
The planning has to be there, right,
Absolutely.
Saurav? And the way
the pre and post planning.
Yeah, and I think Omni Cures is well placed to do that. Shivangi, would you like to add quickly to whatever was shared?
Yes, absolutely. I think very brilliant answers by both our speakers. And before I even answer this question, I think I also would like to briefly touch upon what really affects a doctor's prescription behavior, which is, of course, besides, quality of medicine and its price. So, Swati, even as for the poll that you guys had conducted at Pharma State Academy, in terms of factors affecting a doctor's prescription behavior, the two major factors that came to light were scientific education and MR detailing. So now please just bear with me as I bring in another statistics from a recent research that was published on ResearchGate. Today, only 4% HCPs consider medical reps critical in discovering new scientific information. Now, this leaves us with 96% of HCPs who still want that education, but they are not able to find the right medium to connect with that. So, this scientific education or information doctors receive from, of course, all over the internet, which includes, journals, news platforms, doctor networking platforms, and academic or education platforms like Omni Cures. Today, I think HCPs are looking for balanced disease education hubs. They're looking for short content bites that can be really accessed on the go. They're looking for something which is KOL authored to add that level of social credibility and to ensure that, whatever time they're investing in education is not wasted. And they're looking for something, again, medical council affiliated, again, to add that level of trust in that education. Now, combine this with medical accreditation, and there's nothing more than that your doctor will love. And it might sound like a lot, but all of this, I think, presents a massive opportunity for pharma brands to really build and differentiate their own blue ocean strategy. We feel that long-lasting and impacting touchpoints with HCPs on information they're seeking is likely to turn them around and influence their prescription habits. Our CME programs, for example, start anywhere from 30 days and goes up to 6 months. Now, what this does is that it ensures multiple touchpoints with your doctor digitally as well as by a field force with scientific discourse around their therapy. Now, we have actually done projects which has proven that a lot of our clients who've done CME with us have been able to change their prescription behavior over a period of 6 or 7 months, which I'm happy to, of course, talk about via a case study in the later part of our discussion today. So I hope, Swati, that sort of answers the question here.
Wonderful. So you three have actually, changed our behavior in thinking about this through all the three answers. Thank you, Ashok sir. Thank you, Shivangi and Saurav. And as Shivangi told, we would be presenting a real-time case study towards the end of the discussion. So stay with us to understand how this was done and what were the key outcomes. Let me move towards the next question. This question will be asked by a lot of people, and I have seen already one question coming up there. The question is, Saurav, I would put it to you, but again, any one of the speakers can be answering it. How does conducting this scientific event help a new product launch? Here, my question doesn't end here. It's not about only a new product launch. How can it help a super specialized product or even a Me Too product? So we have all the categories, I think, covered. If I'm not covering anything, please let me know in questions. How this conducting of a event is going to help new product, a Me Too product, a super specialist product. Why should it be done in a planned way? That is a question, sir. Yeah.
So I would rather answer you, Dr. Swati, in a new product. So whenever we are launching a new product, let us not call this a product as a new molecule. In fact, altogether, it is establishing in the market a new molecule. Let us say, just for an example, we will be taking the example of the COVID vaccines. In fact, it was a new molecule altogether. It was coming in. So there have been a lot of advocacies around it, like whether it is good, it is bad, whether it is efficacies, it's how to use the medicines and what are the doses, informations, and other things. This generally doesn't happen before coming to the market. In fact, so basically, when a product is getting launched, all the branding and the marketing strategies are being done by the pharma companies. But at the end of the day, it is the SCPs who are writing it, who are prescribing it. In fact, for them, for pharma company, it is just about a molecule or a product selling. But for HCPs, it is the patient's life, in fact. It is the patient's ailment and patient disease, in fact. So there is a lot of confidence which has to be bring in the initial stages of the product launch. Nothing is getting accepted as in it is like, if we launch a product and we see that, okay, from day one, HCPs will be prescribing it. So it is not the factor. There is lot of scientific information, evidence, and along with that, the patient data which is coming in. So when this type of CMEs are getting conducted, it is something like the KOLs are coming in. They have already tried and tested this product into the patients. They're getting the outcomes. They're sharing the outcomes with other people. So it is all about a confidence building part, in fact. So once the confidence is built up in the community, other HCPs are supposed to follow the trend. In fact, when I'm talking about a trend, it is just like a life cycle of a molecule, in fact. So CMEs plays a very vital role. Now addressing your second part of the questions, if we have a Me Too product. So Me Too product can come definitely into the market if it is not a patented one, but only thing is like the brand will be different. So when we are talking about the establishing of a molecule, it is the joint responsibility of all the pharma companies to come together and educate the HCPs on the molecular part first. Then going ahead with the brand. So once the molecule is established, then you can have all your strategies, like whether the brand is a sustained release, what are the advantages of that brand, what is the pricing of that brand, what is the efficacy, what is the distributions. All these things can come in the second part. But when a molecule is getting established in the pharma industry, it is a joint effort of all the Me Too brands. Brands come later, but the molecule come first. So I would like to say that it should be the CME, which are isolated at this point of time. Going forward, it will not be, I will not be surprised if joint efforts by pharma companies are getting put together for educating the HCPs, in fact. Ashok sir, your thought process, please.
Saurav, I am really delighted with your deliberation, talking about that first and foremost and primarily, it's a molecule which is being established and not a brand. First, the approach is that, when a new molecule is launched, the thought leaders go through the multiple clinical trials, the phase 1, phase 2, phase 3, all the trials they go through, analyze everything, what are the statistical advantages of it, and then starts disseminating this knowledge through the continuing medical education programs, through scientific symposia, whatever you name, through roundtable conferences, various modes of continuing medical education which are there. If you look in the field of oncology, for example, there are drugs which are available, which is a first line. A MAB is used as a first line. Another MAB is used as a second line. But during the course of the clinical trials, they find out, no, the second line can move up to the first line. And it is the thought leaders who disseminate this knowledge based on scientific information. And then they devise a protocol accordingly. And once they discuss the new protocols, that gets reflected in the prescription behavior of a clinician. So it's a clear, correlation between disseminating a knowledge and a physical reflection of a clinician in terms of prescription. I totally agree with you that the first and foremost thing is to disseminate the knowledge about the disease and the molecule which can ensure better health outcomes in a particular disease area. I'll cite another example. For example, a surgery. So when surgery is happening, there's a lot of bleeding which happens once the abdomen is opened or any part of the body is opened, cardiac or whatever it is, or a liver transplant or whatever. Now, there have been various ways and means like glues, like other solutions and sprays by which doctors really battle out to stop the bleeding. Because until and unless they can stop the bleeding, they cannot proceed further with the surgery, nor can they wrap up the surgery. The new stuff came, and it was a patch which was there. And I have seen globally, top surgeons from each specialty, they said, oh God, this is a fantastic thing that we have got in our armamentarium to stop bleeding. And it's just a patch. Within 2 minutes, the patch stops the bleeding, gives a clear feel to the surgeon to proceed on the surgery and also to close the surgery and walk out with a relaxed mind. So the shift has taken place now. Let me also at the same breath talk about that the new products. Doctors are more interested to know about the recent advances in the field of medical science globally. They attend international conferences, they attend the CME program for what? To gain new insight and to gain new knowledge. And that gets later to understand about new protocols which are spread by the thought leaders, and they adopt that. And that's a positive reflection which comes for better health outcomes.
Wonderful. Thank you, Ashok sir. Thank you, Saurav, for very nicely putting this point across. Shivangi, you have anything to add to the discussion?
Yeah, I think I completely agree with Ashok sir here that even in product launches, it becomes even more important to lead through thought leadership-led strategies involving KOLs to talk about what solution your drug provides or what problem does it solve. And in fact, today's product launches, I think, go far beyond designing just a nice brochure or creating, a sharp looking website or just creating an impressive LBL and leaving it in the doctor's office. In fact, as per, the market reports published by McKinsey, only 1/3 of drug launches globally today are successful. And of course, there are multiple reasons for that because the access to HCPs is increasingly getting limited. The market is becoming so dynamic. For example, COVID hit the market and it completely changed how the industry works. There are very few, and I would rather say there are no quality product differentiation studies that are there in the market. So all of this makes product launches today even more challenging. So how can you really make it, productive and successful in today's day and age? I would rather, whatever, anytime, a client comes to us, we always get them to rely on data and statistics, which means that use your today's insight for creating your performance tomorrow. Gain insights into your prescription behavior, gain insights into how your HCP, perceives your brand or your drug or this treatment or this, therapy or this disease line. All of this is, I think, a must before designing any CME that is aimed at a product launch. And in fact, it lays down the very foundation that determines the success or the failure of the launch. So, start by doing a thorough need gap analysis. You identify the practice gaps that exist in the market with respect to the therapy that your drug or brand is in. Define the goals of your product launch. What are the 5 top things that you need your doctors to know? List down the learning objectives for your HCPs within those 5 objectives. Identify what expected changes you want at the end of 6 or 7 months or 1 year down the line. And then go ahead and create your curriculum. So this is something that I would say from the other side of things, companies that can help pharma companies, make these product launches successful.
Thank you, Shivangi, Saurav, and Ashok sir. Awesome insights, and we are receiving very interesting questions, which somewhat are getting answered. Some of them are getting answered through our discussions, and we'll later take them up also. There are few questions which I think one question will answer that, and I'll put this question directly to you, Shivangi, because such questions are coming in at our end. The question is, CMEs usually have a longer time commitment. One question also came about physical CME and digital, so we have to answer that, the usefulness or benefits. But the question is, CMEs usually have a longer time commitment. How can we ensure doctor remains engaged throughout like today we are engaging 400 plus people. So how do you ensure that? And which CME content format is preferred by the users?
I think I'll just actually start by your last line that we've engaged 408 speakers, and leaving aside all my modesty, I would say that what engages users at the end of the day is quality content and content that solves the problem at the other end. Correct. So, in fact, to answer this question, I think you're completely right. CMEs take a longer amount of time, and really it becomes difficult to engage doctors given that they have very small or little time on their hands. So I will answer this question while explaining how we do it for our clients here at Omni Cures. So our typical CMEs range from about 4 months to 6 months, where we spend the initial 20-30 days to create the course outline and the content. And course outline and content seem small, but there's a lot of hard work that goes behind it. So how I was explaining about identifying practice gaps, doing a need gap analysis. So we spend a good amount of time to do this analysis. We lay down the curriculum, we connect with the right associations for facilitating credit points. We find the KOLs locally and regionally, which will connect with the doctors better. So there's basically a lot more, but for the sake of discussion today, this is where I'll stop. For the first 20-30 days where we create the content. What we then do is we connect with the field force of the pharma company and sensitize them on the entire CME program. Like, what's in it for the doctors? How will it affect their clinical practice? What can the doctors look to learn from this program? We also create a lot of marketing collaterals for the field force on behalf of the pharma company, like brochures, learning objective cards, all of this is aimed at helping the field force communicate better to HCPs. Now, what this does is that it gives an additional touch point for field force to invite doctors to the program and also add scientific essence or scientific, discourse part of the discussion. With each content going live, each module or each content segment going live, now the field force is able to create an effective touch point with HCPs, and hence they're able to create another communication with them. So this is how we keep them engaged throughout the period of 6 months. Now, coming to answer your question of physical CMEs or virtual CMEs, I feel both have their pros and both have their cons, right? If you have a larger budget, we've also done physical CMEs for the doctors. But when we do physical CMEs, we don't just keep it like, a one-way learning activity, because that doesn't, keep everyone engaged. So we never like invite doctors onto a venue and just, bore them with presentations throughout the day. We include interactive things like, fastest finger first, or something like live quizzes or live polls, or, inviting somebody from the audience and being a part of the panel discussion then and there. So what this does to the pharma company is that not only does it enable them to invite doctors to the CME program, but also give them a lot of intelligent insights out of doing the program, right? They're able to understand what the doctors are talking about one-on-one, face-to-face, via these interactive activities. Now it depends, because physical CMEs, of course, need a much larger budget, right? So from the venue to the logistics to the speaker management, there's a lot to be done. If you have the budget, definitely go for a physical CME. But if you're looking for something which is less on budget, and of course, you're able to gather a wider variety of audience, a wider geography of audience, virtual CMEs is the way to go. And I don't think, I think we've discussed, I was just discussing with Ashok sir and Saurav yesterday, how, doctors today no longer prefer all those talking heads and, static images. That is usually the course, how CMEs are done in India virtually. You show them a playlist worth 6 hours. Obviously, anybody's going to get overwhelmed. I would never sign up to be on something like that. I mean, for my sake, for example, I sign up for so many marketing courses on Udemy, but I never end up even attempting them, because one, they start with such basics which I already know. So there's a big problem in also understanding how to design your course, how to present your course. All of this needs to be worked upon, and only then your virtual CMEs can be successful. But of course, it brings with it a lot of other advantages. As I told you, that, you can get these audiences digitally. You can get the audience or your HCP who is in the remotest part of any village to come and attend your CME, which might not be possible in case of physical CMEs. So I think everything has their advantages. It makes sense to first, discuss that what are the objectives you want to achieve, what are your goals, what is your budget, and then come to a decision as to, physical or virtual. But I have a way of making physical and virtual both successful equally. So if anybody has questions, you can always write down to me.
Perfect. Thank you, Shivangi. Thank you for the insights. These are coming right from the horse's mouth, who have conducted both of these successfully for various clients. One question I will take up for Saurav from the question bank.
Dr. Swati, yes, just before that, actually, I have been seeing a lot of people asking about this digital and, virtual CME or the physical CME part, rightly answered by Shivangi. But I would just like to add one small thing. So when I'm talking about CME, it is continuing medical educations. Let us understand this. This is a continuous process. When you're talking about a conference, a day conference, it is a medical conference, in fact. That is a part of the CME, in fact. That is not the start, not the end of the CME. So how you are engaging, physical has its own essence, digital has its own essence. Digital is definitely cost effective, and digital gives the privilege to the doctors of, going ahead, going back, and, stopping it at any point of time and retrieving it as per their convenience. So when you're talking about a CME, continuous medical education as a whole, the physical conferences are just one episodes between the entire learning module, in fact. So try to identify those things, try to keep the mindset right that, okay, if we are calling for a physical conference, it is something that we can deliver it, and that can be 4 hours, 5 hours, 6 hours. But yeah, after that, the digital can come into the rescue, wherein bite-sized pieces, the knowledges, the videos, as per the convenience. And the best part is personalization. every HCPs will be looking at your content, and expectations of every HCPs will be different. So when you're putting up in a recorded format or in a, the way can be different. In fact, the presentation can be different, but how you are putting it up, at least, is it interesting? Like the HCPs are really interested about it. So put your content, try the testing, and you will be getting to know that how digital and physical both are complementing each other. That's it.
Thank you, Saurav and Shivangi, for answering this. And you both are giving me again an opportunity to put what we propose at Pharma State Academy: continuing pharmaceutical education. Digital is cost effective. The learning should happen continuously for any sort of professional matter. So keep learning in the digital way, physical way, whichever you prefer. One question, very interesting question has come up, and I'm not able to, forego it till the end of the session for you, Saurav, because it talks about handwriting of doctors and why a prescription company should be taking this up. The question from Mr. Khalid says, my question to all the doctors is that when they are writing a prescription, please write in such a way that is understandable to chemists easily, and without any hesitation, they can give what medicine they want to give. So I think a digital prescription, that the company that you're running, that comes into picture, it removes that barrier of handwriting and
Yes.
What to do.
Absolutely. So handwriting has always been challenging. And yes, company like MyRx, what we have been trying to do, like generating the digital prescriptions, there is definitely a obstacle actually for shifting the habit, because it has been an age-old habit that, okay, we will be writing in the pen and we will be going ahead, and at least patient understand it or not, the pharmacist will be understanding it. So that was the
expected to understand.
Expected to understand. So the changes in the habit, like, the behavior is definitely changing. We are seeing the increase of digital prescription day by day. Apart from that, when you are coming to NMC's guidelines for teleconsultations, and along with that, we have National Digital Health Missions, Ayushman Bharat Digital Missions. All of them are actually focusing on, they have mandated some of the union territories, government hospitals to go ahead with the digital prescriptions. So in 4 to 5 years time, the digital prescription at this point of time is less than 4% of the entire ecosystem. Like less than 4% is the benchmarking of the industry. But in developed countries like Australia, New Zealand, UK, Europe, so it is actually more than 95%. So coming in 4-5 years, so 4-5 years down the line, if we are generating at least 60 to 70% of the prescription digitally, then actually it is a huge shift actually. So company like us, we are continuously focusing on making the process, making the the way of writing the prescription easier, and actually doctors are adapting it, and we will be seeing this shift going forward.
Thank you, Saurav. Thank you for answering it for us. And I'll move to one question for Ashok sir. Sir, what to expect after conducting a CME? What are the expectations that should be there? How can we measure the change in belief of doctors after they attend a scientific event?
Yeah, Swati, basically, the measurement is what was the pre-CME prescribing behavior of a clinician, and what is the post behavior, prescription behavior of the clinician after the CME. And I think this can come through, I think, when it is a digital prescription, sort of you can reflect on it, or the prescription analysis companies like SMSRC and all, they can give that, okay, these are the molecular shifts which has taken place. So you need to analyze, correlate when these shifts have taken place with the HCP. The other is also through chemist quantification. When the company medical representative or the field managers go and try and find out information from the chemist as to what this doctor was writing before, what molecule, and what is he or she writing now. So, it's a mix of different things. It's a mix of analysis of the digital prescription, of the physical prescription, and also about the pharmacy quantification done by the organization. So that's how one can do it. It's also during the course of discussion, I just want to bring in something. It's not just going a good pharma company, an innovative pharma company doesn't go and open the folder or the visual aid or the literature and start talking about the product. No, it starts a discussion with the disease which is there. Starts discussing about the disease, what are the current prescriptions or therapeutic availability which is there, and then start talking about the newer developments which are there. Now, that's when you do that, during the course of discussion, you can also read the mind and correlate with the physical impression of the doctor through the prescription. So it's multiple ways that you can measure what is the impact of pre-CME and post-CME in terms of a physical reflection of a doctor and the change in prescription behavior, a change in belief shift.
Thank you. Thank you, Ashok sir. And Shivangi, this question also I'll ask to you, and also please answer it for us if you have any metrics which tells that what type of molecule or therapy area, any number of time, CMEs or duration, how many times it should be done for a prescription behavior to be visible. Yeah, Shivangi, to you.
Sure. I think it's a very interesting question. And before I answer this, I would also like to address the elephant in the room, that most often than not, most pharma companies relate any kind of marketing function that they do to the increase in their prescription sales. Now, while this expectation is not completely wrong, it's not completely correct either. So in fact, like pharma, like any other industry, has also been seeing that shift from selling to educating. So ideally, all CMEs should be linked to change in HCP's behavior and change in their knowledge, change in their attitude, change in their practice. So before you begin to evaluate, or before you begin your CME program, evaluate what your doctors need to know. And once it's completed, and run that survey again to see that if that behavior has formed it or not. And it's as simple as this, as simple as can be summed up in one line. And most pharma companies, I don't see them evaluating today the impact of any CME impact on doctor behavior. They directly jump to sales. Now, if you were to ask me, I would go a lot more beyond basic metrics of attendance or time spent, because these are very quantitative metrics and they actually offer no insight into the behavior shift or even the behavior in the first place. So I would start by analyzing my HCP engagement state-wise. Now, this will help me understand my brand penetration geographically. Then I would go ahead and understand throughout the CMEs, what were my doctors talking about? What were their interests? What were their opinions? Were they liking the program? What were they not liking? What were the topics they found interesting? What were the topics they wanted to see, but the CME program did not cover? So all of this, nothing can give you greater insights into a doctor's perception more than this. And as I was telling you, we do something here at Omni Cures called the outcomes report. What we do is, like, as I said, I think I've repeated this multiple times in the discussion today, but again, to iterate, because it's very important, like before you begin any survey, you list down a couple of questions that address to understand that what do the doctors need, or what, for example, let's say if I have my drug, what do I want my doctors to need? Do I want to talk about my contraindications? Do I want to bust the myths? Do I want to educate them better on selecting the right administration or the right patient profiles? You list that down, you run your CMEs for 6 months. At the end of the 6 months, you ask them, hey, how is the information that you have just studied or gone through in the last period, did it make any change in the way you're treating your patients? Did you find it useful for the number of consultations that you're handling every day? All of this, I think, is important to really understand, how your CME can really be successful. Another important thing is, what I would see is that if my sales force is communicating about the CME program and trying to get doctors enrolled, check how they're performing region wise, or even in comparison to your competitors, because at the end of the day, no matter how much digital do we talk about, 60 to 70% of marketing in pharma is still being continued by the field force themselves. right? And while doing all of this in-house sounds like a very big challenge, but we at Omni Cures have been doing it for clients for every project. And we sincerely believe that not just CMEs, but like any activity that you do with HCPs, it gives you a treasure mine of insights in the form of data. You just need to understand like where do you want to look and how do you want to assess that information really.
Wow, wonderful. Thank you, Shivangi, for these insights. Awesome. Means I told at the start that you're a wonderful communicator, and I hope I'm proven right.
You're just too kind.
Thank you so much. And then there are a lot of questions, and I'm literally getting confused which one to ask first. But before moving ahead, Shivangi, I would like you to present a case study to the participants who are have joined today, and how successfully you did it. So I'm sharing the screen, and let us go through what happened. Right. I hope the screen is visible.
Yeah, I think you'll have to jump to the third slide.
Okay.
Now, I know that there are a lot of questions, so I am just going to keep it very short, way shorter than what I had planned, because these questions are coming in as very interesting. But just to sort of, cover an actual case study, because of course I've been theoretically talking, and I think me, Saurav sir, Saurav and Ashok sir also have been talking repeatedly on how it can change. But I wanted to bring forth an actual case study that actually helped in shifting prescription behavior, and how you can also do it for your brand. So as I said, like theoretically, we've discussed it a lot, but what does the research say about changing prescription behavior? Now, I'm going to be talking about a small study, which is published again on ResearchGate, available for public access. Now, this research basically studied the effects of pharma-funded CME on subsequent prescribing behavior. And it was found that in each case, there was a greater increase in prescriptions for the drug made by the sponsoring company than for any other drugs in the same class. These physicians were surveyed before and 6 months after their attendance at 3 separate CME events, which were conducted, and they've admitted a change in their prescription habits. Hence, our case in point, pharma should continue to support certified CME. But what is the best way to do it? Because it sounds very overwhelming from what we've discussed in the past 60 minutes or so. So we at Omni Cures since years have been helping our pharma companies or pharma partners in using CMEs, not just for engaging and changing the prescription behavior of doctors, but also using CMEs to generate intelligent insights on HCPs. Something like internally we like to call it as SSOV, which is scientific share of voice, which helps to understand the drug and their brand perception of HCPs even more. So beginning with the actual case study, I will quickly give you a glimpse on this company or this industry partner and the drug. So our industry partner was actually one of the global premium branded generic pharma companies, and their focus was majorly on diabetology as a therapy area. And the product in question were insulins that are indicated to improve glycemic control in adults and children with diabetes. Now, this was a legacy product, which means it was well known amongst the HCPs, but the issue was that its contraindications were more popular than its benefits, which obviously added a lot of brand dissonance amongst diabetologists and endocrinologists. So obviously the key concerns started from very low brand recall, very inconsistent engagement, not a very quality messaging from the field force, remote HCPs where the brand was not able to cover, patient education was not very well done by HCPs, or in fact the HCP education was not done enough to facilitate further patient education. And this project was not just done in India, by the way. This was done for Turkey, Pakistan, UAE, Qatar, Kuwait, Lebanon, South Africa, and so on. I think we can move to the next slide, Swati. Yeah. So whenever any project comes to us, we divide our process flow into 4 major bits, which is the science, the marketing, or the scientific trust, and the content. So the science meant the clinical positioning. What do we want the doctors to know from a clinical aspect? So we wanted to empower HCPs to better educate their patients on the correct way of using this insulin and also administer the right dose. So we started talking about clinical recommendations for insulin initiation and intensification in patients, or global insights for insulin therapy for select elderly patients with multiple comorbidities, for example. Next came in the marketing positioning, the medico marketing positioning rather. So we curated multiple marketing collaterals and aligned them with regional and local HCPs. And the objective was to increase the category awareness and reduce dissonance. Coming for accreditation, to add another level of social trust for these doctors, we partnered with Emory Global Diabetes Research Center and European Accreditation Council for taking up key global KOLs who hosted and facilitated all our modules, all our content. And our content was basically designed for 90 minutes of content, which was divided into shorter content bites. And the content mostly talked about managing insulin administration in type 2 patients. Moving on, Swati. Yeah. So in a snapshot, what we did is, So we partnered with an esteemed research body, which basically obviously gave a very good social credibility and a good trust in the HCPs to come and attend this program. We aligned and liaised with regional and local KOLs in each of these geographies that I'd mentioned in the earlier slide. So to establish a level of connect and resonance with our HCPs, we made all our content device agnostic, which means all the doctor needed was an internet, whether they were on the clinics, on the go, in their cars, listening to podcasts. We made every possible content available and in every device agnostic platform. And we obviously established multiple touch points with our primary as well as the secondary TAs, not just digitally, but also sensitizing how the field force can better communicate to the doctors and enroll them to this program. Another very interesting thing that we did is that we created real-time dashboards that appeals to basically two audiences within the pharma companies. One dashboard was meant for the field force. So whenever any field force was visiting the doctor in the clinic, they could open the Omni Cures app, enroll them to the doctor right away, and give them access to the content. So as soon as they pushed that one button from their phone, the doctor used to receive a link that they've been enrolled, and this is how they can access the content. And on the other side, just one second, Swati. The second bit of the dashboard was meant for brand managers and business units within the pharma company to analyze the progress of not just the doctors accessing the content, but also how their field force is going about and distributing or going about and communicating to the doctors into enrolling them. So all of this was done real time, which means anytime an activity used to happen, the brand managers as well as the field force could see it in their web applications or their apps available with them. So as an objective, the program actually helped in changing the negative perception towards contraindications and empowered the doctors to better educate the patients on the right dosage and administration. So as you can see, 10,000 plus HCPs across 8 geographies using digital as well as physical mediums of connecting with the doctors. Field force touch points were made, and then we received good social listening comments and feedbacks from the doctors, and we were able to also capture a good percentage of the primary audience. Yeah. So before we begin again, we did our outcomes report-led survey approach. So when we started, the actual belief of the drug was that administrating this drug can be detrimental to patients with hypoglycemia, and it was associated with life-threatening hypersensitivity, allergic reactions, and heart failure. Now, this was the actual perception of the brand before we began the CME programs. And then throughout these 6-7 months, we documented the efficacy and safety of this drug. We are using multiple landmark trials. We talked a lot about guideline recommendations on selecting the right patient profile. We used actual case studies, actual patient cases, in which the drug was administered and how it led to improving the situation of the patient in question. We used a very strong network of regional and local KOLs to establish that brand supremacy. And at the end of 7 months, when we ran that survey again, the perception of that drug drastically changed. Now it was considered that this drug is safe with lesser side effects and have indicated to show improved glycemic control, given that if it is administered to the right patients in the right dose and the right form, which was actually the objective when we started this program. So we had changed the objective from not just selling the drug, but actually educating the patient doctors, one, on busting the myths around contraindications, two, how can they really select the right patient profile to make sure that there are less contraindications, and three, what are its actual benefits. And this is something, the education is something, and the perception shift is something that we were able to achieve after a period of 6 months. So we had improved product adoption, we helped bust the myths, we improved the touch points, and we, of course, changed the perception and attitude. And this the last slide on, what doctors were talking about across the globe on this program. So this is how we actually used an actual, marketing problem at hand for a pharma company and solved it using just a CME program.
Thank you, Shivangi, and thank you for presenting it in a concise way. I hope in whatever limited time available to us, we were able to put through across the important points. There is now a flood of questions which are coming in, and few of them have been answered, but still, since some are pressing issues, we'll take it up again for better clarity and discussions. One question is time and again popping up, and I hope we can answer that. That is, should CMEs be done only for the new molecules, or for a Me Too brand, they can be done or not? Means that is the pressing question, and that is what we also expected, sir, that this question will come in the session. So whatever thoughts you have, please share with us first to the speakers related to this, that Me Too brands.
So Swati, can I address this?
Yes, sir.
Okay. It's a wonderful question, and I think for any organization, this is something which will come to the mind, because after all, CME, continuing medical education, is also an investment when they allocate resources for the yearly allocation of resources for marketing, for medical, for others. Now, CMEs are basically a medical activity. It's not a commercial activity. That is something which we all need to understand first, because it's all scientific dissemination of knowledge. The belief shift can only happen in a CME when you gain credibility, you gain trust, and you can have a full scientific content to be deliberated and discussed on this platform. So you also, this needs to be understood that it should meet the expectations of the clinicians, of the practicing physician. Now, whether it is only for new molecules or whether it is also for Me Too. Now, the continuing medical education is not only for a molecule, or not only for a currently used therapeutic categories. For example, if we look at paracetamol, can we do a CME on paracetamol? Yes, the answer is yes. Why? Because the content of the CME will be so rich that it will discuss about various forms of fever which a patient presents. It can be just a pyrexia of unknown origin. It can be an enteric fever. It can be just because of an infection. It can be a flu. All these varieties of fever. So can we create an interest in the minds of the clinicians by discussing about and deliberating about different types of fever and the role that paracetamol plays, and in different doses? Can paracetamol be also used not only as an antipyretic, but also as an analgesic? What are the safety profiles of paracetamol compared to other molecules which are there? So we discussed about the safety, efficacy of the product, even of a Me Too product. Do we, coamoxiclav, for example, has now become a Me Too antibiotic. I mean, you look at, I have seen even prescriptions in a Jhoparpatti type of a place that they are writing co-amoxiclav. It has become a product, generic it has become. Now, is there anything to do CME programs with co-amoxiclav? Definitely there are. Because the question today, a responsible pharmaceutical company will talk about conducting a CME program on this, ensuring they avoid and minimize the chances of antibiotic resistance, which is a big issue today. If you look at the research arena, there's not much research which is going on in the antibiotic area, but antibiotic resistance is a bigger problem which is there. Now, a responsible organization can conduct CME and talk about the right use of co-amoxiclav, the right dose of co-amoxiclav, which indication it should be a first line of treatment, where it should be a second choice. All these things can be discussed. So let us understand the basic concept of a CME. It's a continuing medical education. It's dissemination of knowledge, scientific knowledge to the clinicians. And hence, the content will be different from a new molecule introduction to a Me Too molecule introduction. Maybe that the audience may be slightly different, because it will depend on a particular disease segment or a specialty segment. But my answer is, and I firmly believe, it can be done both for new molecules and for Me Too molecules.
Wow. I think this answers everyone questions who has put such a question. How beautifully you gave an example, Ashok sir, of conducting in a CME for a what I will not even call it a Me Too product. Paracetamol is now in a different league of itself. So that is a wonderful example. Questions are still like coming in on this, like it won't it affect the brand leaders, and won't it benefit the brand leaders more? And see, what we suggest is, please look at the bigger picture, look at the collaboration things, look at what you are intending to do through that CME. Who is going to benefit? You are surely going to benefit. Why will not a doctor remember a company which talked about paracetamol in a different way? That is my question back to you when you're asking that, it will benefit the leader of the brand. Surely, if your efforts are consistent with the right intentions, you are going to gain. And along with you, if someone also gains, why we are very, very focused on the ROI part of doing anything and everything today. That is a bigger question to answer. We'll keep discussing this in our upcoming sessions.
Swati, actually, there are two things on a CME. One is the scientific mindset from the medical point of view, and the other one is a commercial mindset. I think, if people are talking about that, how will my brand get a benefit? That brand thing is not directly related to the CME. Because in the CME, you are not talking about a brand. You are talking about a molecule, about a therapy area. So that's the difference one needs to understand and act accordingly.
Thank you, Ashok sir. Thank you. Saurav, would you like to add something?
No, it has already been addressed. So, Swati, a lot of questions are coming up. So this question has been properly addressed by Dr. Ashok Bhattacharya, sir.
Yeah.
So let us.
Sorry. So before we go ahead, Swati, because I think there are more than 100 questions we have received, and this means that the topic is very, very relevant and actually needs more attention. So I have created one poll, a simple poll, where I would like to ask the attendees whether they want more sessions on this topic, because the reason is that within next 20 or 30 minutes, we will not be able to cover all the questions. And we don't want that it should be one-time affair. If there are more questions, they should be answered. So I'm just posting a poll here. Just respond whether you would like to have more sessions on this topic, and let us know so that we can arrange the. So I'm launching the poll within let us keep 40 seconds only and just select the option whether you want more such sessions or not. The poll is live now. Please select. So accordingly, we can design more CME, or if you say no, then we will not design any CME, because if it is not required, then why to put an effort? And if it is really required, then we are going to put our utmost effort in bringing more topics. Yeah.
Thank you for the overwhelming
So we don't
response.
have to wait actually. So the clear-cut answer is yes.
So
yeah,
let us wait for 5 or 6 seconds more so that we reach that 40-second time. Okay, so I'm ending the poll, and yeah, so I think the result is very evident. I'm sharing the result. So 91% of the attendees want that these sessions should be conducted more, and hence we'll try to plan more such topics. And rest assured that your questions, we have collected all the questions and we are going to answer in the coming sessions. So please be in the groups, wherever, in WhatsApp group or through the email, we'll be connecting with you and telling you the future sessions on the topic. Yeah, over to you, Swati.
Thank you, Satish. And this is how we engage, and this is how you should engage in your CMEs. Thank you for the overwhelming response again. I'll take up few questions. Okay, again, this is about the commercial thing. I'll not take up such questions. Please avoid posting those questions. These are the burning issues, but if you have a talk on that, we can do it in a different session. Impact of virtual CME in less as compared to face-to-face. Okay, Shivangi, this, and Ashok sir, you also can add to the question. Impact of virtual CMEs in less as compared to face-to-face CMEs in the post-COVID scenario. How to create a good virtual CME impact on HCP?
Yeah, I think it's actually an extension of what we have discussed and what I briefly mentioned, that in India, virtual CME means a playlist of 6 hours with 1 hour content in one content piece, which obviously seems very, very overwhelming for the doctors. And especially if you're doing something which is aimed at super specialists. The way our CME is currently curriculum, the way it's being designed right now is it starts from basics and then it goes up to, the most interesting parts. And by the time a specialist or a super specialist starts, they're already so bored, because the CME covers topics which they already know. I mean, come on, they've done that. They've spent so much time studying, in colleges and doing their specialization. They don't really need to see all that basic stuff. So, and our doctors today, of course, they want a lot more than just, simple webinars or, talking heads and just pictures and infographics. So today, before I even answer that, how can you make your virtual CMEs interesting? What do your doctors today need? I would categorize into 3 major heads. One is they want the freedom to choose. They want to control the pace, place, and content. And they want to switch the formats of content availability, based on their immediate needs and the time that they have at hand at that point in time. Secondly, they want something which is immersive and interactive. Right. So especially in the age of YouTube and Netflix and all these on-demand platforms, HCPs, like any other audience, they want interaction, they want participation, they want a visual appeal, and they want continuously newer and fresher formats. And third is that they want snackable content, that, they want it in shorter formats, maximum 5-10 minutes. And they look forward to seeing multiple modes within content bites that can actually be accessed in the moment instead of these long videos or monographs or, conferences or webinars. So Omni Cures, for example, we enable HCPs to choose the content formats that calls to their multiple sensory expansion. So we have divided all our content on the platform into 3 categories: watch, hear, and read. Watch means all your obviously video content, and all our CME content ranges between 5 to 15 minutes. And it's available in so many formats. Like you can watch a KOL video, a KOL talking about a very important topic. You can watch two experts debate on a certain burning topic in the industry. You can watch actual patient case studies that have been performed or used in the same therapy or disease treatment line. So this is all under watch. Then we have something under hear, which is all the audio content. So if they want to learn on the go, they can hear the short podcasts that address burning questions in their preferred selection of disease treatment lines, therapy, and more. And of course, we have the aid, for the old school lovers of who prefer the method of reading, we have something called a back to basics refreshers, which the specialist can, or which any doctor, for example, can really filter out if they don't want to start from scratch. And from back to basics to detailed guidelines and clinical recommendations, we have it all for those who prefer the old school method of reading. So, this is how you make it more interesting. You give them shorter content, you give them interesting content, you automate your feed in terms of how it's being displayed. You've seen how Byju's, for example, create their videos. I don't think the way they educate is really boring, no matter what the reputation of that company is. But the way their videos are, I mean, it's amazing. I am intrigued to really be a part of the discussion. So, for example, here, we had almost 500 people join us live in the morning, which obviously, the topic was interesting. The speakers were great, and I'm not talking about myself, but the ones I'm sharing my stage today with. And the questions were interesting. So obviously people joined in and people did not leave after that, as is the general trend in usually virtual content. So virtual CMEs can be a big hit, but provided you take up the right direction, you understand actually first what your doctors need, and then go ahead and providing. And second point, which really turns off the doctors, as Ashok sir had previously mentioned, it's dissemination of information. It is thought leadership. It cannot be just selling. Right? You cannot use CMEs to sell your drug. You need to educate the audience. Marketing is actually all about educating now. Gone are those days where you could do on the face marketing and really call out your brand and self-proclaim that we are the best. And I still see in so many websites, people have just called themselves the number one. I don't know who's called them number one or what they've done to really come at that pedestal. But this is not how it will work today. So even in physical CMEs, for that matter, if you have all of that basic stuff that we've discussed, it is not going to be a success. So virtual or physical, you need to know how to do it right. That's how I can answer.
Yeah. I agree, Shivangi, on most of the things. Now, there are a couple of things. One is, what about the speaker reputation? That attracts people, whether it's a virtual or whether it's a physical one. Who are the thought leaders? Are we having the right thought leaders and expertise in that? What subject are we discussing? What have we chosen? Is it a subject of interest to the clinicians? Is it something which is contemporary? Those are certain things which attract the clinicians, whether it's virtual or offline or physical. And the content of the whole thing, that's important. It is also important to understand about the timing when majority of the clinicians will be able to attend it either offline or online. So, offline, you need a captive audience. The captive audience can be both online and offline, provided you have the right time, provided you have the right speaker, provided you are discussing on the right subject, and also on who is organizing it. It's the credibility of an organization which is there, which is also extremely important if you want to have that. Now, as you rightly mentioned earlier also, Shivangi, both offline and virtual has got its pros and cons. I am not just looking at the budget. Budget is just one thing of the whole. But what is more important is the content of the CME and the speakers at the CME and the timing of the CME. That's more important. The second thing we have also discussed about, how long. It's not the question of how long. It's the question of continuity in terms of disseminating knowledge on a particular subject by various or multiple thought leaders, both nationally and internationally reputed ones. So that gives a flavor and that attracts the audience to a continuing medical education program.
Absolutely.
Thank you, Ashok sir, and thank you, Shivangi, for answering that. Yeah, questions are again coming towards the commercial part of it, the return on value, the return on investment. I'll park this for next discussions on this topic because today we will focus on how CMEs actually influence the prescription behavior. Shivangi, would you like to take up? You are also saying the question. Any question of interest for you? Because we have limited time, and I will open the platform.
I think we've covered most of the question that we posted in the chat, directly or indirectly. So I think
I
we
would
can
like
take
to
up
take
one more question.
Actually, it is a vital one. Somebody has asked, I'm not sure, I missed that question actually in the overflow of the questions, in fact. So it is something like they have asked like whether the CMEs are impactful, like, you know, doctors are coming to the conferences, they are liking it, they're engaging, but at the end of the day, when they are back to the clinics, they are not doing anything. And we are losing, the essence of the CME, in fact. To answer it, to address it, I would like to see, I may sound offensive, but yeah, this is the fact. So that is the reason I'm putting up a disclaimer on the beginning itself. So nowadays, in current scenario, we are not talking about like at this point of time when you are conducting a CME. So doctors are perceiving it on a different view, and pharma company is perceiving on a different view. So CMEs is all about continuous medical education. But for doctor, it has been something like a change from the regular practice, meeting up with his friends and families, other people, and then finally the entertainment. And for pharma, it has actually become commercials, marketing, and engagement. So where is the education left behind it? So doctors are coming with a different mindset. Their expectation is something different. And actually going back to the chamber, they're actually forgetting it. We need to redefine this one, either physically or digitally. So when you are focusing on educations, we cannot go 3 days, 4 days continuously and then putting it up. We have to mention it in such a way, the delivery of the CMEs, along with that engagement and the and particularly what you have to make it live from the audiences or from the team itself is the expectations. Dr. Swati, your point on it.
Thank you, Saurav. You actually answered what I was trying to answer. So thank you so much helping me there. And yes, these sessions we do for, to show you the change in mindset that is happening, that may happen, or that is not happening even. So through these sessions, our main aim is to keep the discussions going on various vital topics. And this was one of the most vital topics that we think in the coming year also it is that the space is going to change. Dynamicity is the buzzword, and what happens tomorrow, no one knows. So be ready with the right mindset to grasp the future. Thank you so much, Saurav. And one question to you, Shivangi. Quick question: apart from English, in which foreign languages your digital CMEs are available?
We have availability in all languages, so it doesn't get restricted to just English, because we do a lot of projects across the globe. As I just mentioned, even in my case study, we covered 8+ geographies. So we can do translations. That's not a problem.
Thank you. From Mr. Hakim, this question I think was just answered. My question is that during CMEs, doctors' behavior is great towards people, like sort of told. And after when they reach their clinics or hospital, that get changed or it doesn't get changed. So I hope this was answered. And this is an ongoing discussion. Mindset change is a big thing for anyone, for me, for anyone in this forum. You will agree with me, changing the mindset, changing the understanding of the things is a big thing. It will take some time, but it will happen if we are persistent and consistent in our efforts with the right mindset.
So, Swati, just to give an example, this belief shift is a long procedure. For example, even all of us who are present, whether we are talking in the discussion or the audience which is there is so much of thing going on digital, right? Have we all accepted and did we all have a belief shift to move away from physical to digital? The answer is no. It's a continuous. We are slowly and steadily going towards that. It's currently a phygital world. We cannot afford to take the risk from shifting totally from physical to digital. And therefore, we say, let it be hybrid. So if amongst all of us, the marketeers, the pharmaceutical companies, the speakers up here, if we ourselves, our mind shift, our belief shift is taking a time, I think we need to give doctors who are also human beings like us to have the belief shift, to map the belief shift. The second thing is CME is not a one-off program. It is a continuous medical education. And the continuous medical education needs to be done in multiple formats. It can be done by the medical department of the organization through roundtable meetings, through conferences, through medical sessions, and also by the marketing team by discussing the clinical literatures along with the doctors during their visits. So it's a multi-pronged attack which needs to be there to ensure the effects of a CME program for a belief shift in a clinician.
Thank you, Ashok sir, for putting this across in a very understandable way. And this is what we propose, the belief shift that learning cannot happen in digital format. It happens, and you have seen it today that people are engaging, they are questioning the thoughts. The thing is the topic, the interest, the level of discussion that happens in one forum. Now we are now on time, but still, Shivangi, give us just 10 more minutes. We'll open the forum to take up one or two views from very respected guests here. Yeah. So please raise your hands and interact. Please, we'll take up 2 to 3 questions in the next 10 minutes, and then we'll wrap up and bring you another session. Dr. Amit, first of all, you have been there with us a lot. Please, sir, if you can interact.
Yeah, hi, everyone. Obviously, my compliments to Pharma State Academy once again. Oh, incidentally, Pharma State Academy, Swati, please don't take offense, but I've come up with an abbreviation for all of you. PSA.
It is PSA, sir. We call it PSA.
But that means something else for urologists. But anyway, thank you, PSA, for this wonderful topic, very relevant, and it will continue to be relevant for all times to come. And there will be many more inputs. I will just take up a couple of things that came up. One was this thing about, do we do CME for the new molecules or the old brands? See, besides all that has been said by the esteemed panelists, they're absolutely right. But there's another thing which is very important from the marketing perspective, for which we need to do a CME for an old molecule. New molecule is I mean, everyone does CME, so that. But for an old molecule, if I have an old molecule, 20 years old perhaps, there is still new information coming. And even if there is no new information coming, and I don't even want to talk about the disease, as Dr. Bhattacharya said. I don't want to talk about fever because doctors will not look upon it as something great. But new molecules have come which are competitors for me. So vis-a-vis the new molecules, how is my paracetamol still doing well? Is something that I need to highlight to the clinicians so that they do not get influenced by the newer molecules, because also this unsaid thing in the mind of a doctor, new is equal to better. No, not necessarily. Just because an MNC has come out with a new molecule, they are just pushing it only because they have to recover the cost of their R&D. Otherwise, we would not have had 20 ARBs, we would not have had 10 AS inhibitors, we would not have so many SGLT2s and DPP4 inhibitors. There's nothing innovative about that. There is no need gap that is being filled for that by those companies. They just have to recover the cost. But doctors get influenced by the promotion. New molecule. That means a great molecule. I will use it. So in order to prevent that from happening, it is necessary for me to hold these CME programs and illustrate with evidence, which Dr. Bhattacharya very rightly said. It has to be evidence-based. The evidence which shows that my paracetamol is still a very good antipyretic and maybe safer than a lot of other drugs and all, whatever. So please keep that in mind, all the product-related teams that might be there, that even for an old brand, you can come up with great CME ideas and don't shy away from it. I mean, of course, it depends on your budgets and all that. Now, another thing, we have been talking a lot about engagement and we got really excited, like 500 plus people. We are doing a great CME, great topic, a lot of interest. Yes, that is all true. Okay, and that will happen even in your CMEs when you hold it for your particular product. But don't be fooled by that. That is only a sign of engagement. Engagement does not necessarily equate with an increase in your prescriptions. Until you have proof that the prescriptions have increased, there is no reason to rejoice. Okay, we organized something which was very engaging. A lot of people came. That's a success, tick mark. But that's not the end of the story. Engagement is not equal to success. Please remember that. The success, there is only one thing I disagree with. I think one of the panelists who said that this is not all about sales. It is all about sales. CME in pharma is all about sales. If your brand is not growing, you can have the best academic CMEs. I mean, we really don't care from a company perspective. So, great CME, if that leads to brand growth, and brand growth can only come with increase in prescriptions. I mean, people do dumping, people have distribution utilities and all that, but that does not contribute to continuous sustained brand growth. Continuous sustained brand growth is only possible by continued sustained prescriptions. So is the CME increasing the prescriptions? That is the single most important question to ask. And thereby, the single yardstick for success of CME is brand growth, rupee value. So I mean, I may be wrong. You may not agree with me. That's fine. We are all entitled to our opinion. But there is only one single proof of success in the pharma industry. Is your brand growing by rupee value or not? Everything is prescription, the analysis, CMARC data, and all that is fine. But that has limited value. That is still not telling you about the INR growth. I'll give you an example of how mistakes are made. Way back, CMARC came up with an analysis that, this particular antihypertensive is being used by the neurologist. So my company started, marketing. I mean, they will fall head over heels over CMARC. Yeah, great opportunity. Let's start promoting it to neurologists also. When that cardio team is not going to the neurologist at all. But because of the CMARC data, neurologists are writing. Wow. But what was actually happening? I warned them. Fortunately, they listened, they validated. The neurologist is not writing the antihypertensive as a new prescription. He's just carrying over the antihypertensive prescription of the cardiologist. And no new prescriptions were coming from the neurologist. So merely capturing this information from a limited sample universe, I mean, it has its utility. I'm not saying it's useless, but it has to be analyzed with a lot of caution. Okay. So,
thank you. Yeah.
Cut the long story short, please don't think that pure engagement is success. Brand growth is the success. And one last point, very short point. I'm sorry, I know there's a time. We talk a lot about evidence-based medicine, both the doctors also and the pharma industry also. That is not what ultimately, that's not the clinical reality. When I'm sitting in my clinic, I do go through the evidence, but ultimately I use the drug on my own, and my experience is what I believe the most. So E is not only about evidence, E is not only about education, E is about experience. And you have to make allowance for that. You cannot push the MNC clinical global trials, which have been done in totally different geographies, and expect Indian doctors to lap them up ad lib. So the experience is something which has to be integrated into your CMEs, provide some way whereby the Indian experience can be shared, and that validates whatever the global information is. So please keep that component also. Thank you. Sorry for taking up so much time.
No, thank you, Dr. Amit, for the your viewpoint also, and very rightly pointed out the experience matters a lot when a doctor is writing on the prescription. So thank you for bringing out relevant points. Yes, there are topics which has to be debated, and it will take a long to debate it with the participants today. We'll keep arranging such interesting discussions. Thank you, sir. Mr. Akash, if you can.
Mr. Ilyas, let us
Okay.
Mr. Ilyas.
Yeah, hi. I think my question is answered by Dr. Amit. Thank you so much. Because since the so many CMS is not a new methodology, it's been used since it's like an old school methodology. It really make a difference when you approach to the customer in a different way, as a new molecule versus old molecule. So new molecule, we may gather the customers, but the old molecule, it really, how differently we can approach, because not only there is a competition is the biggest challenge. So how differently or uniquely such type of tips, since so many seniors are sitting here. So can we expect such type of tips?
Shreyas, what we are missing the last word that you spoke during.
See, as I mentioned you, that old molecule, definitely the customer shows the interest. But when we talk about the old molecule, so how differently we can approach, to gather, because gathering the crowd also not a big challenge, but continuity, the connectivity between the CME and the chamber, it really makes a biggest challenge nowadays. So the customer definitely show a lot of enthusiasm when they come for as a speaker for the CME, but the post CME, that continuity we are missing from the customers.
I think Shivangi, you would be the right person. That is a mind shift that has to happen. Ashok sir, would you like to answer it?
Yeah, I mean, as I mentioned earlier also, that, with a new molecule is fine, but with the older molecules, there are so many things happening. I mean, during the COVID times, we have seen some of the older molecules being repurposed for the use of issues which have come up during the COVID times as, comorbid issues which were there. So I think this gave a great opportunity for a dissemination of knowledge in terms of repurposing of a drug which was an old molecule. So everything has got, and I keep on talking about that COVID, there is a lot of negative impact, but a lot of positive impact in terms of, for example, this repurposing of drug. To find out how digitally we can fast reach out to disseminate this knowledge to large number of clinicians across the length and breadth of the world. Not only the country, but length and breadth of the world. So, old medications also have, and now, this has opened up a new avenue. There are a lot of Indian companies I know of who are doing certain trials in order to find out the new indication for a very old molecule or a drug which is there. So once that comes out, again, the old molecule will be there. It's not a new molecule, but a new indication which will ensure that through CME, they disseminate that knowledge. It may be a newer dose. It may be, a certain type of patients. So these things can always be disseminated through the continuing medical education for the old molecule also.
Thank you, sir. Mr. Ilyas, due to paucity of time, I will not be able to take up more today. Satish, do we have time for one more question and then we will wrap it up? But before that,
Swati, let's take one more.
Yeah. Before that, I would invite everyone who is present in this webinar next Sunday also at 11 a.m. We have partnered with one of the international companies to bring you a session on QR code data metrics and its use in various departments of pharma. So join us next Sunday also, and we can take up the next question.
Yeah, Mr. Abhishek Singh, can you unmute yourself and just,
Am I audible?
Yes.
Am I visible also? Yeah. So my question was like little bit like towards the future of the CMEs. So like we are seeing metaverse is being used extensively. Like I have come across 2 case studies like Bayer and 𝙍𝙚𝙜𝙜 Pharma using this in their pharmaceutical operations. So do we see similar thing happening in India, and like in how much time, and what are the capabilities the companies and field force need to develop while dealing with such new technologies, which are like newer compared to other digital technologies which we have been using?
Wow. Abhishek, you have given us a topic for a next session. So, we'll see whatever done and written currently. We are also trying to find out what is happening in the metaverse space. Till now, though, I have personally not come across that thing, but you told us an example. Thank you so much for that. Ashok sir, Saurav or Shivangi, any answers from you?
I think, Abhishek, we will be emulating, and I cannot tell you the time frame because you have asked in what time frame. Sorry, I cannot predict that as such, but I can only assure you, like for example, 2 things I would say. Work from home. It was available in the Western world for a long time. In India, we have adopted it now. You look at the digital thing was there in the Western world for a long time. We have started embracing the digital world now. And similarly, we will be embracing newer technologies, and because that's going to be the in thing for tomorrow. So, we keep on talking about the doctors will be perhaps replaced by robots. Today, you look at the robotic surgery which is taking place in India. Okay, in a couple of institutes, it's happening. But robotic cardiac surgery, robotic transplant surgery, these things are happening. So India is one thing we need to be proud of. We might be late adopters, like in doctors, there are early adopters and later adopters. We may be as a country late adopters, maybe because of financials which are involved, but nonetheless, we are not only adopters, but we are adapters. And we do it with a lot of perfection. So we will adapt the whole thing, considering what is required in our environment. And I am sure the day is not far off when we will also be technologically more advanced, and our embracing newer technologies will be faster.
Thank you, Ashok sir. So on this expert topic, Abhishek, metaverse, will need to do more research and bring this topic for our audience. Thank you so much for asking. I'll have to wrap up.
Swati, there is one last hand raise, so let us take that one.
Mr. Akash,
then Mr. Akash, you're the last one just to ask the question. Yes, please.
Yeah, thank you, all the panelists. Since we are going short of time, my question would be very short and crispy for the next section. Probably we as a marketer, we as an adapter, as sir has rightly said, we keep some expectations. Can we have some expectations from the doctors, from the CMEs, which we are going to conduct? It should be, noted it down. Those expectations, the forum, the society approaching for the CMEs. So can we have some discussion on such topic? Because, it becomes a program of education plus a get-together plus, tourists likewise. So probably, is it the right way to have some expectations from that forum as well? That's my question. Short. Thanks for giving me an opportunity.
Thank you, Akash. You have given us a very good thing to do. Rather, Shivangi, you and us can take it up. Expectations from doctor. That is very interesting and good idea from your side.
Yeah. Expectation is, I think, not something that you can, drop a ball on HCPs. And in fact, you should do the opposite. You should understand the expectations of the doctors from the CMEs. What we've been discussing so far in the discussion. I think, and it's not just relevant to healthcare, right? Even if you're in any other industry, let's suppose you're selling a shampoo. You understand that there are 5 problems in terms of dandruff or itchy scalp and things like that. That that is present in your audience right now, and you create a solution and you create a nice shampoo, you create a nice branding, but you still cannot definitely pin down any expectation that I am going to sell to this person and this person should buy this, right? Because at the end of the day, the discussion, the perception to each individual is very, very different in the industry or in the audience at large. So I think it should go the opposite way. You need to understand the expectations better and try to deliver it closer to the expectations of the audience in question.
Yeah. Shivangi, I think there has to be, demand is creating a forum or something like that, which catches the expectations of doctors from the CMEs.
Yeah.
So we'll take this up. Thank you, Akash, for asking this question. Thank you, everyone, for joining us today and engaging in this insightful discussion. Thank you, Ashok sir, Saurav, and Shivangi for being here. 20 minutes more than what was said. All the participants, we thank you for being with us from the start till the end and listening and asking questions. Please keep doing that. We appreciate it a lot. Give us a feedback, what we did right, what we did wrong, what we need to do better. And join us next Sunday at 11 a.m. as you did today. Thank you so much for joining. Signing off for today. Swati.
Thank you, everyone. You have a nice Sunday.
Thank you.
Thank you.
Nice
All right.
And
Thank you.
before everyone leaves, I am posting one feedback form in the chat box. This is really important. So request everyone to just click on the feedback form and then you leave the meeting and you will land on the feedback form and you can fill it.
Thank you so much, Satish.
This is how you leave the meeting. Yeah.
Yes.
And we'll end the meeting after 30 seconds so that you have time to click at the feedback form link and then you leave the meeting.
Thank you for giving us your precious time on a Sunday. We really, really appreciate you joining us.